Hey, welcome to the Allergic Code. You are watching part 19 of MCQ series. Before we start, I have an important update. A new mock test link covering part 6 to 10 is published. For those who haven't checked out it, I have posted all the details on the channel's post tab, and you can also find those links in the description box here on this video. You can drop your comment for the passcode under any of the videos on this channel. Just make sure you clearly mention the specific part when you ask for the passcode, so I know which one to send you, like passcode 1 to 5 or passcode 6 to 10. To catch every new prep videos and mock test links as soon as it drops, hit that subscribe button and turn on notifications. Now let's not waste our time and check out the first question. Most used scalpel blade in dental surgery. A. Blade number 11, blade number 12, blade number 15, D. None of the above. This is an easy question. The answer is obviously C. Blade number 15. The number 15 blade is the most used one in dental surgery because it has a small curved edge. Its shape fits perfectly around the curves of your teeth and gums, giving surgeons precise control to make clean, safe cuts without damaging the surrounding tissue. So let's see our next question. When to choose shade matching? A. Before preparation. B. During preparation. C. After preparation. D. None of the above. The answer here is A. Before preparation. So once you start preparing a tooth, teeth dry out fast from isolation and airflow. Dehydrated teeth temporarily look much whiter and brighter than they actually are, leading to a mismatched final crown or composite restoration. Moreover, eyes get fatigued during long procedures and rubber dams alter surrounding colors also. So it's advised to select the shade under natural light on fresh hydrated teeth for the most accurate natural match every time. So let's see the next one. The dentist wants to put a rubber dam to restore a tooth. After the rubber dam is placed, the dentist notices redness and swelling of the gum underneath. What could this be? A. Autoimmune reaction. B. Immunosuppression. C. Hyperimmune reaction. D. Immunodeficiency. The answer is C. Hyperimmune reaction. When a patient develops sudden redness and swelling right after a rubber dam is placed, their body is having a hypersensitivity or allergic response, which is essentially a hyperimmune reaction. Most rubber dams are made of natural rubber latex. In sensitive individuals, the immune system drastically overreacts to the latex proteins, triggering localized histamine release. This causes immediate inflammation, tissue edema, and erythema. So let's check out the next question. A 15-year-old patient presents with mild yellowish discoloration of the tooth enamel caused by long-term tetracycline use. What is the most appropriate initial treatment to manage this mild tetracycline staining? Options are A. CMB and pumice microabrasion, B. Composite veneers, C. Home bleaching, D. Porcelain veneers. The answer is C. Home bleaching. As we know, at age 15, the nerves inside teeth are still very large, making them sensitive. Putting veneers on a young patient damages healthy tooth surface forever. Microabrasion doesn't work either because tetracycline stains sit deep inside the tooth, not on surface. Home bleaching trays are the best choice because the bleaching gel safely soaks deep inside the tooth to lift the yellow color without grinding away any healthy tooth. The next question is, a 11-year-old patient comes immediately after trauma. His two upper central incisors have been avulsed 20 minutes ago. After being properly conserved and all conditions satisfied, for how long will you splint them? A. 1 to 2 weeks, B. 2 to 3 weeks, C. 3 to 4 weeks, D. 4 to 5 weeks. The answer here is A. 1 to 2 weeks. When an 11-year-old's central incisors are avulsed and brought in within 20 minutes, here the time matters a lot because those PDL cells are still alive. Our main goal is to help the ligament heal naturally. We use a flexible splint for just 1 to 2 weeks. If we splint for too long, the bone thinks the tooth is fused and starts eating away at the root. That process is called ankylosis. 2 weeks gives the ligament just enough support to reattach while keeping the tooth healthy. And the next question is, patient had a trauma. His upper incisors show misalignment. What would it be? A. Luxation. B. Root fracture. C. Alveolar fracture. D. None of the above. The answer is C. Alveolar fracture. While a single shifted tooth points to a lateral luxation, our clue here is the plural word, incisors. When multiple front teeth shift out of place together, they usually bring the underlying jawbone with them. That means the bone supporting those sockets has fractured. So that's why option C, alveolar fracture, is the answer because it explains that entire shifted segment. Now the next question. The occlusal surface of first deciduous molar shows staining in occlusal grooves. After examination with explorer confirms no signs of caries, management is A. Observation after 6 months, B. Class 1 restoration, C. Sealant, D. None of the above. The answer here is C. Sealant. So this patient has staining in the deep fissures of his first primary molar, but the explorer confirms there is absolutely no activity here. We never place a restoration on a healthy tooth, but here the tooth is acceptable to caries. To protect this tooth, option C, sealant, is the right choice. If we choose observation after 6 months, it is not recommended because observing means risking a complex cavitation by the next appointment. Let's move on to next question. The patient is back for a regular follow-up after 6 months. In his last visit, X-rays were taken and they revealed no caries. Which X-rays would he need this time? A. Two bite wing radiographs, two periapical radiographs, no need for X-ray this time, none of the above. The correct answer is C. No need for X-ray this time. When a patient comes back for their routine 6-month checkup and their previous X-rays from just 6 months ago were completely caries free, we do not take new radiographs. Standard ADA or FDA guidelines state that low risk patients only need recall bite wings every 12 to 36 months depending on their age. Taking X-rays every 6 months without a clinical reason exposes our patient to unnecessary radiations. I'll always follow the ALARA principle, only take X-rays when there's a clear diagnostic benefit. Next question. A 55-year-old patient has very bad oral and dental hygiene and has been wearing an ill-fitting upper denture for a long time that he does not take off. He shows a red lesion on the palate in the area limited to the denture. The patient is a smoker. Diagnosis of the lesion. A. Lichen planus. B. Epulis fissuratum. C. Denture stomatitis. D. Oral cancer. The answer is C. Denture stomatitis. When you see a red inflamed palate perfectly shaped like an upper denture, that's a classic sign of denture stomatitis. Leaving a loose denture in 24/7 creates a dark, moist trap where yeast like candida can thrive, especially when paired with poor hygiene and smoking. The redness stays strictly underneath the denture base because the acrylic itself acts as the reservoir for these microorganisms. To fix this, tell the patient to leave the denture out at night, practice good hygiene, and treat the fungal overgrowth. Now, the last question for today, simplest pulp treatment. A. RCT, B. Pulpotomy, C. Pulpectomy, D. Pulp capping. The answer is D. Pulp capping. When we compare pulp therapies, we measure simplicity by how much pulp tissue we actually have to remove. With pulpectomy and RCT, we remove the entire pulp tissue. With a pulpotomy, we scoop out the top portion. But with pulp capping, we don't remove the pulp at all. We simply place a gentle protective layer right over or near the tissue to help it heal and stay alive. It's the most conservative and simplest pulp treatment. So that wraps up part 19. Don't forget to check out the mock test link in the description below. Make sure to hit that subscribe button and stay tuned for part 20 where we will keep breaking down these high-yield topics together. If you find these sections helpful, give this video a like and leave your feedback in the comments. Thanks for watching and I will see you in the next video.